Huples Cat. A little while ago I let my Canadian subscribers know about a sale at Sale where first aid kits were at 50% off. I had the 2 smallest kits posted to me and I did a review on them. Unfortunately the 3 bigger kits were not for post and you had to go to the store to get them, so I gave up on the idea. Well, Kitty went to Whitby to have a birthday dinner with a friend of hers, and while she was there she went into Sale and she got me the only remaining large kit that was available. The biggest one. Very happy to have this. This is the Mountaineer from the Adventure Mountain series and it's designed to look after 20 people for 28 days. In Sale, the normal retail is 185 Canadian dollars plus tax. They tried dropping it to 150 to get rid of it, and then they dropped it to $93 because they made it 50% off. The Adventure Medical series I actually kind of like. Their gear is pretty good gear. Most first aid kits have substandard equipment. They tend to have good gear. I would have got her to get me the other 2 kits, but unfortunately the Whitby store, they were sold out. Maybe next year. I think they claim this weighs 1.1 kilograms. It's not that heavy. The handle straps are pretty flimsy and Canadian-y, but I'm aware of the fact that my American brethren and sisters beneath me understand very little about mathematics. 1.1 kilograms loosely translated to 2 pounds and 7 ounces. So for an individual hiker, this is a bit big and a bit bulky for what you would need. The blue colour would stand out in most situations over the maritime. If you wouldn't really get this for a maritime kit, I don't think. And there's an orange strip on the top part to let you know. Nice padded bottom, I kind of like it. One of my criteria is can you open this with one hand? Now this is actually specifically designed for an expedition, so there would always be multiple people around. However, let's give it a go. Lost my right arm. Opens easily with one hand. And as you can see, there's compartments. I'm going to open them all and show you what's in them. A pair of shears there and some big nappy pins. There's 2 pouches at the bottom, one of which is a rip off and take with you pack. I like that idea. And the other one is stop bleeding fast. I'll leave the contents list up for a while so you can look at it. So that's going to be the question. Is this kit good enough for 20 people over 28 days hiking in the wilderness or kayaking or canoeing in the wilderness or snowshoeing in the wilderness? Whatever they're doing in the wilderness. We shall see. First off, I'm going to empty the bag and I'll show you the contents for each pouch and I'll explain what I think is good and bad about each pouch. But you get this free book with it. It's pretty decent. It has a lot of different techniques and tips in here that you might want to know about in advance of having to use them in the wild. That's a pretty good book to get in a first aid kit. These are the contents of the book. If you're the first aider for a group of 20 people for a long time in the wilderness, you should read this book, you should do some courses, and you should go beyond this book. But as a starter book, it's pretty good. But please never be in a position of having to use a first aid kit and having to read one of these books at the time of injury. It's kind of embarrassing. It's also very frightening. You don't really absorb new information that well when you're full of adrenaline. We opened up the kit and the dog has not moved. This rip-off one down here is actually designed to actually go to the summit. So if you have to not take the big kit with you, you have to go on a quick journey, you can take this instead. This has 2 of their watertight resealable bags in, which I had so much trouble with when I reviewed the other little kits. What was in the stop bleeding fast section? 3 pairs of nitrile gloves, sort of a cheap knockoff Israeli bandage, 1 pad and another pad. This is more than you get in most kits, but this is not enough. This is really not enough. You need about maybe 5 to 10 of these and they need to be a little bit thicker than this. You're really going to use a lot of these if somebody's bleeding. What's in the cuts and scrapes? The boo-boo section. This was somewhat interesting. There is 4 alcohol pads, which are actually great for fire starting. You really don't need these unless you're injecting people, but maybe you're injecting people, I don't know. This skin prep stuff is really good. What you do is you clean the wound, clean the area around the wound, and then you put this on, and then you put the bandage on and it sticks it better. Certainly if you're in the wilds, that's a good idea to carry. It's going to be hard to get the bandage off. Massive amounts of this stuff to clean the entire limb. Very good idea. A few of the normal type bandages and a few of the knuckle bandages. Let's open one of these and have a look at it. Fabric bandage covered in paper. Gauze covered in paper. If there's any staining on this and it's dry, you can assume the inside is clean but not sterile. If there's any wetness on the outside of this, I wouldn't really use it unless I had no choice. If there's no staining and it's dry, assume the inside's sterile. You want to keep it sterile. So clean the wound as much as you can. Clean around the wound as much as you can, and then get your piece of bandage. I wouldn't actually bandage this type of a wound, but if it was in the wild I might. So it's easy access, so to make it easy access you just do this. And now you have the outside which you can touch, and you have the inside which you don't want to touch. So how do you deal with this? Well, quite straightforward it turns out. You have this last piece here, and when you pull like this, you can pull this apart, exposing the inside. You don't want to touch this piece at all. This piece is sterile, but there is paper on this piece, so you can hold it there and do this. You then do this. Now you get your wound, and your patient, get your wound, put this over the wound, like so, then holding the paper, not the inside, peel it like this. And if you're smart, and I'm a child, or I don't like pain, get the edge of this and just slightly fold it over a little bit, like so. So when you come to take this off, you just got to edge. Oof. Medication section, bit of a disappointment. All I got were these 3 afterbites and 4 of these, which are designed to put medications in. However, the book actually gives you some ideas about what you should be putting in this. You might need a doctor to prescribe these for you, but depending on where you're going in the world, they might. Okay, fracture and sprains. A very nice C-collar splint. I like this. You can use for cervical or whatever you want to use it for. Quite light, very easy to use. Good thing to have. Tensor bandage. I'd like more of these. And 2 triangular bandages. Now what's in the instrument section? A pencil. A pair of sharp tweezers. I prefer better tweezers than this, but these are small, I guess. And this one actually is well contained inside the container. It won't come out. Some duct tape to repair clothing, not to be used for wounds. You might want to use this to create splints, depending on the circumstances, but don't put this on people's skin. Don't put this over wounds. A digital thermometer. This is actually a really good idea. I quite like this. This is a good thing to have in a long-term kit like this. A single-use CPR valve. You shove that over the dead person and you blow air through it. Yeah, it's in there. I'm not sure if it's going to be that much use in the wilds, but hey, it's in there. It's lightweight. 3 patient assessment forms. Like this, good idea. When you treat somebody, keep a record of it, because if you get sued or the coroner wants to know what you did, you won't remember properly. There is giving you a record of vital signs, tells you about evacuation plans, stuff like that. A good addition. As I already mentioned, they do have good blunt end shears here and some 3 big, huge nappy pins. Good idea to have. Last but not least, wound care, burn and blister. The only thing for burns is these. That's it. Very insubstantial for burns. Not really happy with that. I would want more stuff for burns over a 28-day period. 1 pack of steri strips, wound closure. I would want more than this, but this is better than you're getting most kits, but still I want more than this. 2 packs of moleskin. 20 people over 28 days. You might want more than that for blisters. And there's many ways you can treat blisters, and you can go online and look at it, but none of this stuff is actually going to help you with that. This is an irrigation syringe. The idea of this is to actually squirt fluid into a wound to get rid of stuff inside the wound so you don't get sepsis. And if you are going to do this, don't use it with a metal needle. This doesn't have one, because the metal needles will fly off. Gauze bandages, 2 of them. Again, there's not enough stuff here. There's not enough bandages here. If you have a burn, burns weak. It's very, very sticky quite quick. 2 sterile cotton tip buds. If you're going to use these in wounds, be very, very careful. I'm not altogether sure I've ever really used these at all in clinical nursing practice in trauma, other than to apply Vaseline around a wound to protect the wound from bleach when we used to put bleach in wounds, which was never a good idea. Decent tape, really nice tape like this, great idea. Remember, if you use the tape, keep one edge folded down so you don't have trouble using it. When you get the tape, it's like this and you have to find where it starts, and it's really hard initially. Fold it over. So next time you need to use tape, grab hold of that, pull the length you need, cut it, and fold the edge down again so you can get it quickly and easily. These are in the back of the wound care section. There's 3 of these. They're thin but useful, and that's what you would use in hospital. Same with these, same with these. I like this. They've got 2 eye pads here. You put them over the eye, not into the eye, and it's nice if you have a bit of protection outside of the eye. I've done a video on that in the past, but these are good to have. The very last thing in the kit's this, and it kind of surprised me. It's a disposable surgical nail brush. I mean, this would be good. You can really get in there and clean yourself and scrub yourself down, getting ready to do advanced surgery in the bush. There's not much in this kit to allow you to actually do advanced surgery. I'd rather not have one of these. I'd rather have alcohol rinse. I think it'd actually be much more useful and would last a lot longer. Alright, I'm going to put it back together now. So it only took me about a minute or so to repack it completely after completely emptying it, which is good. It shows the design of the bag is actually great. There's lots of little compartments in here, lots of space for extra gear. You will have to put extra gear in here. So what's my overall evaluation of this? For $92, $93 Canadian plus tax, well worth it. Really happy you got this. This kind of kit's great. If you don't have any first aid kits in the car or at home, something like this at this price at $93 is absolutely a fundamental thing you should think about getting, because you can revamp this and reuse this, and it's a good starter kit. But if you're going into the wilderness with a large group of people, there's a few things you should do that this kit doesn't tell you to do. If you're the designated healthcare provider, if you're the designated medic, you actually need to evaluate all of the people on the trip before you even set out. Various things like allergies and any coexisting conditions such as diabetes. This should have dextrose tablets in it for diabetes for such a large group, for such a large period of time. Pretty much of an oversight. It's not a prescription, but they could easily put some dextrose tablets in here. That's something I would want to carry if I'm going into the wilds with a large group. Preferably dextrose that dissolves in the mouth without having to be swallowed. Remember, if you start shoving hard candies in people's mouths when they're unconscious, you might kill them. As ever with my kits, I put one pair of the gloves on the outside, so if I'm seeing the casualty, the chances are the first thing that will happen is I'll get blood on my hands, assessing the damage and assessing the situation. So the second thing I want to do is rip this off here, open it up, put the gloves on, so when I open this pack, I'm not touching the insides with blood on my hands, so if I don't use stuff inside here, even if I touch it, chances are I can reuse it. You don't want to daub the inside of all your kits with blood. For an expedition, the bag for the first aid gear should be a dry bag. It should be completely sealed, so no animals or critters can get in it and no water can get in it. If it rains heavily or if you fall into a lake, all of that stuff can happen. Or even if it's snow, you don't want the snow melting and getting inside the first aid kit. So you really want to make sure this kit is in a dry bag. Online, from the company itself, they're suggesting this costs $225. And I don't know if that's Canadian or American, but either or, it's a lot of money. And either or, for a lot of money for an expedition bag, I would expect this to be a dry bag. I really do. Other than that, the basic design of it's really nice. The handles, like I say, are a bit flimsy, not sure how long they're going to last. And something like this is pretty bulky and is going to compress in a camping situation. So when you pack these, when you put extra stuff in, be careful. Give it a good think. If I throw this across the room, I'll squeeze it as hard as I can. Will it destroy the stuff inside? And if the answer is yes, repack it. Because if you're going camping or you're going canoeing or you're going mountain climbing, you really want your kit to function if you need it. Now the medications are whatever you can get hold of. There's quite a few other drugs they suggest in the book, and it depends on what you're doing. Like for altitude or for marine activities, you want different types of drug. But again, the medication should be specific to where you are, who you are, and what's going on. So yeah, ease of opening. It's a B+A. It's not too hard with one hand, and that's important in a kit. The stuff inside this, it's easy to get at, it's easy to completely open, and it's easy to repack it. So the access is, again, about an A or an A+. I really like the access to this. There is extra space in here to put extra stuff in. You're going to need to do that. I like that, and I think the book is absolutely brilliant. For me as a Canadian, the book is going to be $25. The digital thermometer is going to be $19.99 at least. The C collar is going to be $20 at least for me. So for a $92 value, this is good value for me. Where you can, get your safety equipment and your outdoor equipment and your preps if you're a prepper when they're on sale. Don't buy cheap gear that's cheap. Buy expensive gear that's cheap. Tell me what you liked about this kit. Tell me what you didn't like about this kit. Tell me if you think it's worth 93 Canadian dollars or not. I think it is, even with tax. I would add a lightweight plastic eye shield to go over the iPad. I think that's always a good idea to have. I would have added a pen light to assess pupils. I think that's a really important thing on an expedition in the wild. Don't just rely on this for everybody in the 20 group. Make sure they've all got their own individual first aid kits. You can't have too much first aid if somebody's arm comes off. Doodles! This has been a 2024 Well Covered for Injuries Terrier production. Whoops, this has been a Wolfie Terrier production 2024 where the props are attacking him.